let's get started. Happy Friday, everybody. Thank you so much for joining us. We are really excited to offer this next webinar in our series from 2024, an intro to breastfeeding. I want to welcome Casey Callahan back. She is a wealth of information. She's an occupational therapist with us at MetroEHS, and she is also a certified breastfeeding specialist. So I will turn the floor over to Casey because I know that's why you're here and want to learn from her. So Casey, welcome and let's go.
All right. Hello. So I put together just kind of a short little intro to breastfeeding, some kind of things I feel like are great basic knowledge for everyone to know. But I feel like there's just so much to know, and I'm still just, learning new things all the time too. So let's see. So again, like I said, Casey Callahan, I'm an occupational therapist. I've worked in pediatrics for 10 years and specialize in feeding therapy. So I am a certified breastfeeding specialist, certified in Beckman oral motor approach, and sequential oral sensory approach to feeding, or also known as SOS. I do a lot of infant feeding and swallowing and work with kids with RFID. So, and then a little bit more about me on a personal level. So I am a mother of two, my own babies. I breastfed both of them till about 18 months. And it was not a smooth process. I actually struggled more with my second than my first, which is not what you'd expect. Um, and I sought out a lactation consultant that helped me immensely and really inspired me. I saw her one visit and she was just so helpful, and we troubleshoot and we just kind of kept at it until we got my son nursing again. And it was so inspirational. Before I had left, I got all the information from her on how to become a lactation consultant myself. So 5 years later, he's starting kindergarten and I pursued my own certification. So that's just kind of how this all came about. And there's my little Meredith on there. And August is National Breastfeeding Awareness Month. So we thought it was very fitting to do this little presentation this month. So this has a lot of information on this slide, but I actually really had to kind of weed a lot of things out because there are just so many reasons to breastfeed your baby. The biggest one is balanced nutrition. The makeup of breast milk adapts to the baby's needs. So that's from birth to into toddlerhood, sickness. It's going to adapt to exactly what baby needs. And part of that is an immune system boost with custom antibodies for germs and things that your baby is exposed to. There is a reduced SIDS rate of 64%. Read that right? Yes, or 64% overall infant death risk by as much as 40. So I don't know if I read that right, but so reduced SIDS rate of 64%. That was just huge when I read that. And I really wanted to share that information. There's a lot of different reasons behind that. Some of them are breastfed babies wake up more. Some of them is the nutrition. So they don't fully understand why that is yet. But I think that's an important thing to know. So breastfeeding is time saving. Breast milk is always ready, available in the perfect temperature for baby. Mothers who breastfeed are at a lower risk for cancer, heart disease, and diabetes. There's a whole list of other conditions that you decrease the risk of as well. The physical contact helps create special bonds between you and your baby. It aids in postpartum recovery, contracting the uterus back to its original size. So in those first few weeks, when you nurse baby, your body automatically starts contracting, and it helps shrink the uterus back to its original size and just helps with a faster recovery for the mom. So I thought that was kind of an interesting fact that not a lot of people knew. I know I didn't know that when I had my first baby. So it's time saving. There's no bottles to wash. It's cost effective, always ready and free. Studies show breastfed babies have higher IQ and less chronic conditions like asthma, eczema, food allergies, ear infections, and there's a whole list of those. Early exposure to a variety of flavors resulting in a more adventurous eater in toddler years. Mom's breast milk will change in flavor depending on what types of foods she's eating. So things I wish someone would have told me is to take a breastfeeding class prior to birth. Once baby is born, it's just like a whirlwind and there's so much going on. It's just really great to be able to learn prior to baby and just feel more prepared. You can get familiar with your breast pump prior to delivery. So you can get a breast pump free through your insurance, and you can get that prior to delivery, which not a lot of people know. And it's really important to get familiar with it, take it out of the box, sanitize everything, hook it all up, turn it on, and just kind of make sure that you know how to use that and you feel confident and are kind of ready to go. That's another thing, though, that you can take a class, a breastfeeding class, and a lot of times they will do some education on breast pumps as well. This is a huge thing I just learned when I did my certification. Did not know for either of my babies, but if you hand express a few drops of milk after nursing, it will greatly increase your supply later on. So those first few weeks after you feed baby, just kind of hand expressing just a couple drops on a teaspoon will increase your supply up to even 6 months later, according to research. So I thought that was a really simple, easy thing you can do to set yourself up for success. Baby's first few days of feedings will be colostrum. So it's not exactly breast milk. It's more yellow in color, thicker, and it is just a huge boost of vitamins, nutrients, antibodies, and everything that your baby needs right at birth. Along with that, I like moms to know that you are producing enough. 1 tablespoon is a full feed in the first few days. Baby's stomach is very, very tiny at that time, and they'll gradually increase the quantity for feedings. Your milk supply won't come in for a few days postpartum. It could range from 1 to 6 or 7 days. Sometimes it can take to come in. Typically, it's around day 3, though, that you'll see your milk come in. So don't panic about that. It's not right on day 1 that you're going to see a big influx. Babies cry more the second day of life. I really wanted to include this because a lot of times I feel like moms don't realize this fact, and they think baby's crying on day 2 because they're hungry and they're not getting enough milk and their milk supply hasn't come in. And so a lot of times we'll see supplementing with formula at that time. And that can really be detrimental to baby and mom's feeding relationship. The whole relationship is supply and demand. So if you're supplementing when you don't need to be, that's telling your body you don't need to be making as much milk, and it's almost kind of going to put you backwards. Of course, there are different reasons where you would have to supplement with formula, but it's not always the case. And it's really good to just be knowledgeable and talk to a lactation consultant before doing that. If nursing is painful, stop and seek help from a lactation consultant for troubleshooting. It might be a little bit uncomfortable, and there's definitely a learning curve, but it shouldn't be painful. If it's painful, that's a sign that there's something that could be adapted or adjusted to make it more comfortable for both mom and baby. There are tons of different positions that you can nurse in. I think the most common would be the cradle, but there's the football hold, sideline, laying back. These are all great positions to try, and they can help with different issues that mom and baby might have. Sometimes, depending on mom's anatomy, there might be one position that's better than the other. So it's a great thing to kind of just learn and try a few different things and see what works best for you and baby. Alrighty, whoops, there we go. So what to look for in baby's latch. So body position. Baby's chest and stomach should rest against the mother's body with baby's ear, shoulder, and hip in alignment. So we don't want baby facing straight up to the ceiling and being on their back. You really want them in a sideline position, skin to skin. As far as their mouth, you want a wide open mouth angle with lips flared out, covering the majority of the areola. So this is a picture I added on there with nice open mouth latch to kind of demonstrate what I was talking about. So a jaw should move in kind of a wave-like motion. We don't want to see chomping and up and down movements. Baby's chin should be touching the breast to help open and get a deeper latch. As far as the nipple, that should rest deeply in the baby's mouth. Sucking should be smooth, sustained, and rhythmic with audible swallows. Just to make sure that it is an efficient suck and not more of like a non-nutritive, similar to something you'd see on a pacifier. So when to seek support of a lactation professional. After delivery, the hospital should have a lactation consultant on staff. They may ask you if you want to see the lactation consultant, or they may not. It's always a good thing to ask and advocate. Sometimes they won't offer it if it appears that mom and baby are doing okay with nursing. But I always suggest just having them pop in and give you any tips and pointers. It can be really beneficial. So if your baby is slow to gain weight or loses more than 7 to 10% of their birth weight and doesn't gain it back within 2 weeks, it's typical for babies to lose up to 10% of their birth weight. The important thing is that they are gaining it back within that amount of time. If you're having pain or you and baby are experiencing difficulty with feedings, so some of those difficulties could include a painful latch on breast, an inefficient latch that would result in milk transfer difficulties. So what that means is babies latch, they're suckling, but they're not able to pull the milk from the breast. So slow weight gain and growth, stressful feedings for mom and baby or caregivers, frequent feedings with less milk intake per feeding. So that could be a sign that they're fatiguing or working too hard. So they're wanting to eat often, but not eating a lot quantity-wise. Or if there are concerns or suspected tethered oral tissues, tongue ties, lip ties, and things of that nature, it's always great to reach out and have a consultation. So this is a question I get often. How long should I breastfeed? I put a few quotes on here because this is kind of, there's no straight answer. A lot of different organizations have different opinions. So the Latch League states, ideally, the breastfeeding relationship will continue until the baby outgrows the need. So meaning that that is a child-led decision. The World Health Organization and UNICEF recommend that babies be breastfed for at least 2 years. And the American Academy of Pediatrics recommends exclusive breastfeeding for about the first 6 months, with continued support for breastfeeding after solids are introduced, as long as your baby desires, for 2 years or beyond. So what all that means to me is ultimately breastfeeding is a very personal journey between you and your baby. There's no one size fits all answer. Many families choose to combination feed using pumped breast milk, bottles, and breastfeeding, combination of all of these different methods. One thing I did find interesting though is just recently the American Academy of Pediatrics did bump the recommendation up to 2 years. Prior to that, we only recommended 1 year, whereas other countries were already recommending 2 years. So I thought that was interesting that the US was a little bit behind on that. Um, I don't want to get off on a tangent too much, but I also thought it was interesting that the American Academy of Pediatrics recommends bottle feeding only up until a year, but they recommend breastfeeding for 2 years. So that's an interesting discrepancy, and can be a little bit confusing if you're doing combination feeding. So. So this is a great time. I wanted to take some questions and just have a little bit of discussion time. And I tossed on there a few quotes that, kind of resonated with me. Eat local. Um, Success in breastfeeding is not the sole responsibility of a woman. The promotion of breastfeeding is a collective societal responsibility. And part of that, I think, is education and acceptance. Um, so that was one of the reasons I thought this presentation would be really fitting for this month. Another thing I thought was interesting is breast milk has never been recalled. So it's very, very safe for baby. And then this quote I just thought was cute that I make milk. What's your superpower? All righty. So
I
any
love that. I've seen people
question?
wear those t-shirts, Casey, where it says, I wear milk. I was never brave enough to do that while I was breastfeeding, but I thought they were so funny.
Yeah, no, there's some really funny, cute quotes out there. So
Well, we can definitely open the floor for questions. I asked you guys to unmute if you had any, but I did want to ask one that was submitted. And I think you touched on this, Casey, which great job with all that information. But let's give you a chance to go over it again just in case. And the question is, if my milk does not come in for a few days, do I need to supplement with formula?
yes. So I did touch on a few different topics related to that, but ultimately, this is a really big misconception that breast milk doesn't always come in right away. It does take a few days, up until a week. Typically, you do not need to supplement in that amount of time, as long as you're getting colostrum and getting, at least a teaspoon of feeding from your breast, the baby can continue nursing. Um, and a lot of times in the past, that was something that a lot of healthcare providers were misinformed on, and they would push moms to supplement in the hospital. And that became a really big problem as far as outcomes long term with nursing and the supply and demand factor. So there's a lot of different parameters that have been put in place. So there's something called a baby friendly hospital. And to become a baby friendly hospital, you have to meet a certain different criteria. And a few of those are that the hospital cannot offer formula, they can't provide samples, they can't give any advertisements or have those in the hospital for formula, just because it was being kind of pushed at moms in a little bit of a vulnerable time.
Mm. And it's so hard because it is a learning curve. I mean, that's what I experienced with all three of my kiddos, that they each behaved differently at mealtime. And so a question that I thought of while you were discussing this is, a lot of us are working moms and we go back and forth, and pumping for me was not fun. I did not enjoy that. So we went back and forth from bottle to breast. Is there often confusion, or do some babies get confusion from bottle and breast and going back and forth?
That can definitely be difficult for babies, but I don't like the term confusion because I feel like those are just two completely different concepts and they require different oral motor patterns and different skills from the baby. So depending on the oral motor makeup of a baby's mouth, they might be more efficient with bottle feeding or breastfeeding, one or the other, and not necessarily able to go back and forth between, because of some of those different issues such as like tongue ties or lip ties. Um, it might be mom's flow being really strong or the letdown being really fast, whereas the bottle, it's very paced, kind of continual release. So there's a lot of different reasons that going back and forth can be hard for babies, but I wouldn't say it's just confusion. It's really just two different skills to learn.
Great. Well, are there any questions from our attendees? We thank you guys so much for coming. You can unmute and ask anything, and we'll give you a couple seconds and then we'll just close up for today.
I have a question.
Yeah.
I was wondering, I have two kids already, and I didn't breastfeed with them. But with my third, coming in November, I would like to breastfeed. And I was wondering, like, okay, like how, so is it like on demand, like when the baby cries, like how often am I doing it? Is there like a schedule or like I do want to do bottle and breast. So like how does all that work?
Yeah, so that's a good question. And there's a lot into that. It's a little bit trickier sometimes with nursing in the sense of you can't look at how many ounces they're getting. You can't, keep track and do the math of, okay, they ate 4 ounces 3 hours ago. And sometimes that can be a weird transition, especially if you were used to bottle feeding and you can really track that and have that confidence that like they're getting enough. So you really have to trust, you and baby's relationship and knowing that it's really on demand, especially at the beginning. They'll let you know when they need to eat. Um, and sometimes they might just be suckling and doing like a non-nutritive suck. So at that time, you could always, kind of dis discontinue the feeding and like offer a pacifier or something of that nature. But as long as you're following their growth curves and, they're continuing to grow and thrive, you can know that they're getting enough milk. Um, yeah, I don't know. Did that answer your question?
Yeah, it did. Thank you.
All right. Do we have any other questions from our audience?
I do have a question.
Yeah. Hi, Rebecca.
Hi. So I'm planning on breastfeeding and the pumping kind of along what you were saying about the confusion part. Is there like a certain amount of time I need to wait in order to introduce the pump, or should I do that right away? Like I'm not sure how to go about adding the pumping in the beginning.
hmm Um, so that is a really personal decision. And it kind of depends on a lot of different things. Sometimes, if mom is going to work or going to be leaving the house, sometimes that time frame can really, those factors can impact how soon to start with pumping. Um, If you want your milk supply to come in, I would give it a few weeks of nursing and maybe just toss the pump on here and there if you're feeling engorged. And then maybe after the first month, kind of looking more into a pumping schedule. Is there a time frame? Like, will you be working or away from baby, or is it more of just having that balance between caregivers, feedings?
My husband's gonna be off work also for a few weeks, and I know that he does want to be able to kind of help out and everything. So, but I've read that, it could possibly get confusing in the very beginning if you're, like you said, using the bottles and breastfeeding at the same time. So I don't have a specific timeline or anything. I just want to,
Yeah.
yeah.
It can't hurt to attempt, the bottle, maybe do like an every other, and you'll see how things go and how baby responds. And if they're having trouble with the bottle or nursing, that would be a good time to kind of, seek out like a lactation consultant and just do a little assessment to see why they're preferring one or the other. Although there are a lot of babies that go between both of them pretty easily. Um, and you could always do even like an every other pump and then breastfeed, every other feeding to kind of get that going. At the beginning, though, typically baby will clear your breast a little bit better than the pump will. So it would be good to kind of rotate back and forth if you'd like to do both.
Okay, thank you.
That's really interesting that baby's the expert, right? Even better than the
Yeah.
pump.
Yeah. I mean, they have some really cool pumps out nowadays. They have the hands free that you just kind of pop in your shirt, like wireless, and people will be pumping at work and stuff. And those are really handy and neat, but those also don't clear your breast as well as one of the medical grade pumps that you'll get through insurance. So it's fine to be using those, but make sure that you're just using them when you need to be and not as like your main pump.
And it's so great that insurance covers it. And I think you said that all insurances cover breast pumps now, which was not the case several years ago.
Yeah, and one thing that not a lot of people know is that you can get that script. If you asked your doctor for the script ahead of time, you can get the pump before baby is born, and really kind of start playing around with it.
Great. Well, Casey, thank you so much for this information. Really appreciate it. This is such a special time between mom and baby, and I'm so glad that you can help and be here. If you guys have any other questions, please don't hesitate to reach out. You can reach out to the webinar address or info@metroehs.com. Casey's available for any kind of consultations or anything like that. Metro is here for all your child's needs. Physical therapy, occupational therapy, speech therapy, ABA, and even more, mental health, feeding. So please contact us and reach out if you have any questions or needs at all. We thank you so much for your attendance and have a wonderful long weekend. We'll see you all next time.
Thanks for having me.
Bye-bye.